In this episode, we're going to be discussing a PCOS and ovulation game changer that you could be missing, and that is inositol. Welcome to the Finally Get Pregnant Naturally podcast, the podcast helping women identify the real reasons you haven't conceived or stayed pregnant so you and your partner can finally grow the family of your dreams. I'm your host, Dr. Katie Wood. Let's dive in, shall we? After today's episode, you'll learn what inositol is and how it supports hormone balance and ovulation in women with PCOS, but also even in women without PCOS. The difference between myo-inositol and D-chiro-inositol and why the ratio matters, and how to start incorporating inositol safely and effectively into your fertility plan. PCOS is one of the leading causes of fertility challenges. And if you've been diagnosed with PCOS or suspect that you may have it, you've probably heard that your hormones are out of balance. Maybe you've been told to lose weight, exercise more, eat less, go on birth control, or even try a medication called metformin. But what if your body could actually just benefit from better hormonal signaling? And that's where inositol comes in. So inositol is actually a vitamin-like compound, and it's technically part of the B vitamin family. And it plays a crucial role in how your body uses insulin and how your ovaries respond to hormonal messages. So, for women with PCOS, insulin resistance is one of the most common underlying causes. And when insulin isn't used effectively, it can trigger a cascade that raises testosterone, disrupts ovulation, and creates those classic PCOS symptoms like irregular cycles, acne, and difficulty getting pregnant. So, inositol essentially helps restore that communication. It improves insulin sensitivity, helps your cells respond better to blood sugar, and supports the signaling between your brain and ovaries to promote regular ovulation. That is one of the biggest factors that we're seeing with PCOS. So, let's talk about the forms. We have myo-inositol. This is the form naturally found in the body and is the most studied for improving ovulation and egg quality. And then we have D-chiro-inositol, and this form helps improve insulin sensitivity and metabolic function. So the magic really happens when they're combined in a 40-to-1 ratio, mimicking the natural balance found in healthy ovarian tissue. And really, this combination has been shown to improve ovulation frequency, support more balanced hormone levels, reduce elevated androgens like testosterone, improve egg and embryo quality, even for those doing IVF, and it can even help support mood and anxiety levels, which can also be a symptom of PCOS. And I mentioned that whether you have PCOS or not, if you're struggling with any of these things, inositol may be a helpful supplement for you. So let's talk about food sources of inositol, because obviously food before supplements. While supplementation is often needed in therapeutic amounts, you can still find inositol in whole grains, beans, nuts, seeds, and citrus fruits. But with that said, most women, especially those with PCOS, benefit from adding a high quality supplement, since the dose really needed for hormone and ovulation support is much higher than what diet alone provides. How is inositol commonly used? Most studies are using about 2,000 milligrams of myo-inositol and 50 milligram of D-chiro-inositol twice daily. But as always, and especially if you're already taking medications like metformin or just other medications in general, it is important and absolutely vital for you to check with your practitioner before starting any new supplement to make sure it's right for your body and dosage needs. And I do want to note, inositol is generally very safe and well tolerated, but as with anything, more is not better, and high doses of D-chiro-inositol alone can actually reduce egg quality. So you want to make sure that you are following that 40-to-1 combination and that you are using a dose given by your provider. So let's recap today's episode. We learned that inositol helps restore healthy insulin signaling and support regular ovulation, two very key fertility foundations for PCOS. The 40-to-1 myo to D-chiro ratio mimics your body's natural balance and supports better egg quality and hormonal harmony. And small shifts like stabilizing your blood sugar and using targeted nutrients can make a massive difference in your fertility outcomes. If you are someone who is struggling with PCOS, you need to go back and listen to this past Tuesday's episode. I had a registered dietitian on, Caitlin Johnson. She is a PCOS expert, and you do not want to miss this episode, okay? So this past Tuesday's episode. And I just want you to remember your body isn't broken. It just needs a little support. I want to thank you so much from the bottom of my heart for taking the time to listen to today's episode. And I hope you have a wonderful rest of your day. And I'll see you on our next episode, released every Tuesday and Thursday. Are you ready to finally discover why you haven't been able to get or stay pregnant? The Ultimate Fertility Blueprint is a quick, insightful quiz designed to reveal your overall capacity to conceive and help you discover potential root causes and areas to address to improve your fertility so you can finally get and stay pregnant. You'll find the link in the show notes. As a quick reminder and disclaimer, this podcast is for educational purposes only and is not a substitute for medical advice. Always consult your doctor or healthcare provider before starting any new supplement or protocol, especially if you're actively trying to conceive or undergoing treatment.